talk on an emerging topic on vector-borne diseases, the Kyasanur Forest Disease, an expanding tick-borne public health problem in India. Kyasanur Forest Disease, it's also called as monkey fever, is transmitted by a tick called Haemaphysalis spinigera to man, and monkey also suffered the infection. And this infection was first reported during 1957 in the Kyasanur Forest of Shimoga district in Karnataka state of India. In man, the KFD virus typically causes hemorrhagic fever manifestation, and the man infected with the virus clinically present with certain characteristic symptoms like high fever, frontal headache, severe myalgia, and followed by bleeding in certain parts of the body, particularly the nasal cavity, throat, gingiva, and very rarely in gastrointestinal tract. And humans are usually dead-end host, and man-to-man transmission never occurs. And as far as the KFD virus is concerned, the tribal people, the forest officials, ecotourists, and nature lovers are at high risk of acquiring this KFD virus. And every year, the disease affects around 400 to 500 cases in India, and about 80% of the infected person automatically recover from the infection. Only 20% of the infected people develop characteristic biphasic syndromes, and very few develop the hemorrhagic manifestations. And the case fatality rate of KFD has been estimated to be 2 to 20%. And about the virus being a flavivirus classified under the family Flaviviridae, and its genome is around 11 kb in size, and which encodes for essentially 3 structural as well as 7 non-structural proteins, and which are very much needed for the replication of the virus. And among the structural proteins, capsid protein, envelope protein, and pre-membrane protein, and which are very, very essential for its structure. And KFD virus is antigenically closely related to the tick-borne virus serogroup complex. And as far as the vector is concerned, Haemaphysalis spinigera is incriminated as the vector of KFD virus. And of course, other members of the genera Haemaphysalis were also suspected to transmit the infection, since the KFD virus have been isolated from this species. And many of the important other species of Haemaphysalis genera are Haemaphysalis cuspidata, Haemaphysalis bispinosa, Haemaphysalis kyasanurensis, Haemaphysalis wellingtoni. And interestingly, ticks belongs to other genera than the Haemaphysalis were also suspected to carry the virus, and their role in transmission or dissemination of the virus is not yet known. KFD virus circulates in certain small mammals, namely rodents, shrews, and certain ground-dwelling birds, and in many of the tick species. And as far as the monkey is concerned, this virus infect the monkeys, namely the Semnopithecus entellus, popularly known as langur monkey, and the Macaca radiata, popularly known as the bonnet monkey. And this virus was isolated from a bat species also, which is called the Rhinolophus roxy, but their role in the maintenance or dispersal of KFT virus is not yet known. When we talk about the distribution pattern and expansion of KFT virus in India, the virus was first found causing outbreaks in the Shimoga forest of Karnataka during 1957. But after that, the virus was found infecting to the nearby places in the Karnataka state up to the year 2012. And during 2012, the virus was reported from the Nilgiris district in Tamil Nadu. Subsequently, during 2013 to 15, this virus was found spread to the Nulpula, Wayanad and Malappuram districts of Kerala state. And surprisingly, in the northern side, during 2015 to 2017, the virus was also reported from the Pali village of Satari Taluk, Goa state. And during 2016 to 17, the virus was also found reported from the Sindhudurg district of Maharashtra. These evidences clearly shows that the virus is gradually spreading to the newer areas. And next, coming to the diagnostic aspect of KFT virus. In human, the acute virus infection has been diagnosed by the application of MAC ELISA, which is also called as IgM capture ELISA, and this is being a rapid assay and routinely used. In addition to this rapid assay, other classical virological tests known as the heme agglutination inhibition assay, the neutralization assay are also used for the diagnosis of acute cases. And nowadays, the gold standard method, the reverse transcriptase assay, as well as the real-time PCR assay has been routinely used. As far as vector surveillance is concerned, the KFT virus has been isolated from the vector from the field-caught Haemophilus species by appropriate inoculation in susceptible cell lines or in laboratory animals. And this virus can also be straight away demonstrated by using the RT-PCR assays, and this assay is very much useful for detecting the virus as well as characterizing the genotype of the virus. As far as the treatment, prevention and control of the KFT virus is concerned, timely providing supportive therapy which is found reducing the mortality in humans, and application of the acaricide called lindane is found very useful, especially in the forest floor during clearing the dead monkeys infected with KFT. And for personal protection, the popular tick repellents DEET, DMP, DPP, which are found around 90 to 100% protection against the tick bites. Finally, of course, vaccination is a very good strategy for preventing and control of the disease. Now, coming to the vaccine of KFT virus, we have a successful inactivated tissue culture based vaccine is available with us, and the vaccination schedule include administration of 2 doses targeting the 7 to 65 years old age groups in 1 month apart. And since the vaccine induced immunity is short-lived, the booster dose is always recommended, and as the booster dose is administered 6 to 9 months after the primary vaccination, Thereafter, the administration of annual booster dose is recommended for 5 years. Finally, coming to the future priority research area of KFD is concerned, the development of a novel rapid diagnostic assay is always a prime requirement, especially conducting large-scale surveys, and a field-based assay is very essential. The second point is improved vaccine is a very important requirement, and effective antiviral drugs are very much needed for treating the patient, and innovative vector control measures are always required, and considerable research needs to be concentrated on this area. Finally, adequate training for clinician and technician who are involved in detecting the KFD cases are very much needed for implementing appropriate control strategies in India. KFD virus, being a highly infectious virus, while handling appropriate biosafety norms should be strictly followed. Thank you.